Movement, activity, and mobility positively affect one's overall health. When someone is recovering from a severe illness or injury, their mobility is often reduced, and they may be unable to perform ADLs. Healthcare team members play a vital role in preventing the physical and mental decline in functioning that can occur from immobility by proactively implementing interventions. Risks of immobility are well known, and complications are viewed as avoidable. In fact, many insurance companies do not reimburse healthcare agencies for complications resulting from immobility, like pressure injuries, because they are viewed as avoidable with the proper care. Therefore, nursing assistants must be diligent in their actions and observations to maintain their clients' health and prevent complications. Promoting clients' independence in completing their ADLs and encouraging activity as tolerated can help prevent all these complications of immobility. Encouraging activity as tolerated means involving the resident in movement, while also adhering to mobility restrictions noted in the care plan and observing for respiratory changes that indicate the resident may be lacking endurance to maintain the activity. Sometimes a client's lack of endurance in completing activities requires the nursing assistant to segment their ADLs. Segmenting ADLs refers to breaking up tasks to accommodate the client's activity intolerance. An example of segmenting ADLs would be assisting a person to bathe in bed as independently as possible, letting them rest after bathing, and then returning later to assist them with dressing and grooming to get them ready for the day. The following slides will outline the potential complications of immobility and preventative measures. Body system, integumentary, skin, potential complications, pressure injuries, preventative measures, repositioning everyone to 2 hours, ensuring proper hygiene, providing incontinence care as needed, providing skin care, encouraging good nutrition. Body system, musculoskeletal, potential complications, muscle atrophy, contracture, preventative measures, assisting with active or passive range of motion, ROM exercises, applying splints or positioning devices as prescribed. Body system, digestive, potential complications, constipation, incontinence, preventative measures, encouraging fluids if not contraindicated, encouraging fiber intake, encouraging activity as tolerated, providing frequent toileting, providing bowel and bladder retraining if needed. Body system, respiratory, potential complications, decreased lung function, preventative measures, encouraging incentive spirometry or coughing and deep breathing, encouraging activity as tolerated. Body system, circulatory, potential complications, deep vein thrombosis DVT, decreased cardiac function, increased fluid retention, preventative measures, ambulating, applying compression stockings or other compression devices as ordered, encouraging low sodium intake as prescribed, obtaining accurate daily weights, elevating extremities. Body system, psychological, potential complications, depression, preventative measures, involving clients in social activities, offering pleasurable individual activities if not interested in group activities, encouraging visits by family, friends, or volunteers for one-to-one interaction. The applying prosthetics and orthotics lessons previously covered in this course describes devices such as a foot split to prevent musculoskeletal contracture. There are additional devices that can prevent a client's hand contracture. as well as prevent their fingernails from creating open skin areas in their palm. The first type of hand device is a cone that slides into the palm of the hand and is kept in place with a soft, elastic band. The cone should not be forced into the fingers, but placed gently. A second type of device is a palm protector that is softer than the cone and separates the fingers from one another. If neither of these devices is available, a washcloth can be rolled and placed underneath the fingers. See the image of a cone and palm protector. See the images showing application of the cone and palm protector.